Good afternoon. My name is Heather Runkle, and I'm an undergraduate student at Georgia Southern University studying health education and promotion. Today I'm going to discuss a case study involving coronary heart disease. A patient from rural Georgia believes that his healthy lifestyle will prevent him from suffering from having a heart attack, like his late father who died of a heart attack at age 50. He reached out to a patient education specialist at a Kaiser Permanente healthcare facility in Atlanta, Georgia, in order to gain some reassurance in his beliefs about his health. The patient is a 25-year-old male. According to a report written in Harvard Medical School's Harvard Men's Health Watch called Premature Heart Disease, as many as 4 to 10% of all heart attacks occur before the age of 45, and many of these occur in men. The author of the report also states that conventional coronary heart disease predominates in young adults, accounting for approximately 80% of all heart attacks. However, the report mentions that the short-term outlook for heart attack victims who are younger than 45 is actually better than it is for older patients, which may be due to the fact that younger victims often have single vessel disease and well-preserved heart muscle. In contrast, a heart attack in a younger victim should never be taken lightly. Moving on, the patient in this case study has had no medical complaints. With that in mind, the patient mentions his father's past so that the patient education specialist can have a better understanding as to what factors led to his father's fatal heart attack. He mentions that his father had high cholesterol, was overweight, consumed foods that were high in fat content, and never exercised. Firstly, I'm going to discuss high cholesterol levels. High cholesterol levels have been proven consistently to be an independent risk factor for impending coronary heart disease. According to the National Cholesterol Education Program, a desirable cholesterol level is less than 200 milligrams per deciliter. A borderline risk cholesterol level is 201 to 239 milligrams per deciliter, and a high-risk cholesterol level is anything greater than 239 milligrams per deciliter. The consumption of foods that are high in fat content contribute to these high cholesterol levels, which, as I've said, is a risk factor for the development of coronary heart disease. The patient himself claims to follow a vegetarian diet, which is typically low in fat content. However, according to a report in Harvard Medical School's Harvard Women's Health Watch, simply eliminating meat from one's diet will not reduce fat content in one's diet. According to the report, in order to reduce fat content, one must replace saturated fats and trans fats with good fats, such as those found in canola oil, olive oil, and nuts. The patient in this case study mentions that, in contrast to his late father, he exercises regularly. Exercising regularly has been proven to reduce one's blood pressure. High blood pressure, which, according to the Mayo Clinic, is when the systolic pressure is 160 or higher and the diastolic pressure is 100 or higher, is a risk for coronary heart disease. In this case study, the patient's blood pressure is 110/70, which according to the Mayo Clinic is considered normal blood pressure. Clearly, the patient is maintaining an exercise routine that effectively keeps his blood pressure at a normal level and consequently reduces his risk for developing coronary heart disease. The patient's body mass index is 20. Body mass index is a measure of one's body fat based on his height or weight. According to the Centers for Disease Control, even though body mass index is not a direct measure of body fat content, it is strongly correlated with different metabolic and disease outcomes as more direct measures of body fat. According to the CDC, the patient's body mass index of 20 is considered to be normal and healthy in regards to his weight status. The patient's health body mass indicates that he is far from the risk of being overweight, which contributes to high cholesterol and high blood pressure, which are true risk factors for coronary heart disease. The patient in this case study also does not smoke. Smoking is a major risk factor for the development of coronary heart disease and a heart attack. Nicotine is a powerful vasoconstrictor which increases blood pressure and causes hypertension, both of which are risk factors for coronary heart disease. This patient's abstinence from smoking is a protective factor for developing coronary heart disease and ultimately a heart attack. In short, this patient does not smoke, eats a potentially low-fat diet, exercises regularly, and maintains a healthy blood pressure, all of which serve as protective factors in developing coronary heart disease. However, the patient's father may have had an underlying genetic condition that could have increased his risk for developing coronary heart disease and his fatal heart attack. In order to obtain a more thorough family history, I recommend that the patient education specialist ask more specific questions, especially about the patient's mother and the father in regards to his genetics. I recommend that the patient educator stress the importance of knowing about the patient's family history to the patient, and hopefully he will provide this information going forward. I recommend that the patient educator reassure this patient by explaining to him why his lifestyle is positively protecting him from the development of coronary heart disease and a heart attack. The patient educator should positively reinforce the patient's behavior by commending him for maintaining his healthy lifestyle. Thank you.